At Madison Memorial Hospital, we've seen an increase over the past couple of years in mental health issues, suicidal ideation, and completion of suicides. We want the public to really be aware that there's a lot of resources available.
With depression and with like severe depression, it's almost like a fog. Like you can be in a fog and it can be very like self-isolating, but just realize that there are people that do care and your life is valuable, whether you think it is or not, because of the thoughts that you're having. It's important to get help, and there's no guilt or shame in asking for help, with getting help. I think it's important to utilize the support around you.
Often we do send people to inpatient treatment if they're feeling suicidal, if they're not safe with themselves or safe being able to safety plan and go home.
Hi, my name is Ashley. I'm a licensed social worker at Madison Memorial Hospital, and we are talking about mental health.
I'm Marcy Crook. I'm also a licensed social worker at Madison Memorial Hospital. So as you can see, we're filming in Smith Park, right across the street from the hospital. It's really important for people to be able to get outside of their home and not isolate in their home.
Part of being a social worker and the values and ethics of being a social worker is providing a non-judgmental space for someone. And I feel like Marcy and I, we are very comfortable talking about taboo subjects such as pornography, sex addictions, homosexuality, and I feel like it is important to be non-judgmental and provide a safe space for people to feel like they can come and seek help, and we can help provide resources to get help if people feel like that's an issue for them.
So one of the stigmas that I've recognized with our mental health patients is their conflict that they have internally, their moral conflict with their beliefs, their religious belief system. Oftentimes they feel guilty or shamed for having feelings of suicidal ideation or depression, and will, instead of seek help, will just continue to hide that and to sit on that. And then it festers and then it grows.
There's 3 apps that I have been recommending while I've been working in the emergency room. One is called My3. It's an app that you can actually put in a safety plan, and it allows a person to have a safety plan if you're feeling like you're dealing with some suicidal ideations. This is a good plan for you. There's also 2 other ones that I've been recommending. One is called Insight Timer and Headspace. They're very popular apps, but they help with meditation and just being mindful of the feelings that you're having inside of your body, and it just helps to calm the anxiety down.
When you do have a broken leg or you have a broken foot, you go to a medical doctor to get that treatment for that. It's really important to remember mental health is the same, and it's very sensitive, and it needs care by a specialist. It's not something that you can always manage on your own.
Calm is another app similar to Insight Timer and Headspace, but it just allows a person to have meditation. There's meditation music, guided meditation. If someone is into that, it's something that I recommend if a person is experiencing symptoms of anxiety. It just helps to calm those emotions down. There is also the Crisis Center in Idaho Falls that someone can go and get treatment. It's a voluntary treatment place. There are nurses there that can help. It's a behavioral health.
In addition to the self-care, that Ashley talked about with the apps and the meditation and being in tune with your own personal symptoms, there's also additional help if it gets to the point where you're feeling that you cannot get out of that hole or that mental health issue.
You have to be really mindful of yourself. So if you are, depression can be normal with just life. But if it's getting to the point where you're isolating yourself, your personal hygiene is going down, I think that's when it's time, if you're isolating yourself more so than what needs to happen, then that's time to seek help.
Ashley and I are both very in tune with that here. We see the issue continuing to escalate, especially with the COVID-19 pandemic. It's gotten a lot worse. I think that's a normal reaction to what's going on in the world. And it's not stigma. It's not a bad stigma to come and ask for help if you need help.